is just a huge honor for me to be podcast interviewing Dr. Jeff Foucrier. Thank you so much for coming by my house.
Absolutely.
Oh, it's an honor, man. I can't wait to talk to you. Dr. Foucrier has been a treating physical therapist for 4 years, obtaining his Doctorate of Physical Therapy from Regis University in 2011. As a graduate of 2 Jesuit institutions, Seattle University Undergraduate and Regis University Graduate, his philosophy of practice centers on education and access to research-based treatment modalities and functional movement. He has been working with Spooner Physical Therapy since 2012, during which he's adopted a very dynamic treatment method which incorporates guided treatment and patient-centered values. Jeff is very passionate about international medicine and promoting social justice, as well as access to skilled care for all populations of people. This has led to international trips to Nuevo Rosito, Mexico in 2009 and 2010, as well as Addis Ababa, Ethiopia, in 2011, and I went there too.
Did you really?
Yeah.
It's a fantastic place.
Oh my God.
Beautiful. Absolutely beautiful.
Remind me to tell you my Ethiopian dental story. Within the clinic, he strives to offer comprehensive care with an emphasis in orthopedics. He has a special interest in treating myofascial pain syndromes, headaches, vestibular dysfunctions, temporomandibular joint disorders, and neck pain. Jeff has undergone self-guided studies in orthopedics, which has led to an American Physical Therapy Association board certification as an orthopedic certified specialist. Additionally, he has received training and certification for the treatment of myofascial trigger points from Dr. Jan Dummerholt, a leader in the field of intramuscular therapy and pain management, through MyoPain seminars. Outside of the clinic, his passions include his wife Tammy, young daughter Liliana, as well as an active lifestyle that reflects his own love for camping, hiking, cycling, and running. Jeff has a deep-seated affection for the ocean. As a native of Seattle, Washington, as well as the mountains after spending some time in Denver, Colorado for his graduate studies. I went to Jesuit school too.
Did you really? What school?
Creighton University.
Creighton, yes. I know Creighton very well.
So I take it you're Catholic or Catholic?
I was raised Catholic, Roman Catholic.
Yeah, so was I.
So a very strong French Catholic family.
So I always think of French Catholics from Montreal, Quebec.
Yeah, my father is actually from, he was born in Toulon, southern France.
Really? You were born in France?
No, my father was.
Oh, your father was.
Yeah, and then he was then raised in Paris. He came over to the United States, moved to the United States with his family roughly when he was about 11 or 12. So he's been in the United States since then, but I have a lot of family still around Paris.
We just lectured in Paris, last year?
Yeah, about a year ago now.
Yeah, I think the greatest, looking back at my 55 years, I think the greatest education, you had school, I had that, but visiting 50 countries was a bigger eye-opener
I
to
would
me.
say so.
Because, you can read it, they say if you never read, you live one life,
Mm-hmm.
but if you read autobiography, you live another life. But man, when you live in the purple Kool-Aid,
Mm-hmm.
you don't know what's purple.
That's right.
Until you go see, and so I always, the only reason I go to other countries is to lecture to other dentists.
Okay.
So it's really cool because I'm not going to go there and stay in the Holiday Inn.
Right.
I'm picked up by my homies,
Right, right.
and so they always say, we're going to put you in a nice hotel. I go, no, I want to live in your house.
Yeah.
I'll never forget when I was staying in a Polish doctor's house, Marcin Dolecki. And the neatest thing of the trip was just opening up his refrigerator.
Yeah.
And it was all these Polish sausages and
Right.
tomatoes. And
Right.
and I always thought that was the coolest part of the trip, actually living,
Absolutely.
in the dentist's house
Absolutely.
and learning their views. But my gosh, you're a specialist in so many things. I don't even know where to start. So a lot of the stuff that we said probably flies over everyone's head. I think doctors all have that problem. They talk 5,000 words of Latin and Greek, and the patients and they're like, "What are you talking about?" So what is myofascial pain syndrome?
That's a good question, and you're right. I think that oftentimes, at least what I find in my profession, is that I don't know if we purposefully make things more complicated than they actually need to be, just so that it sounds more important than it actually is. But what myofascial pain syndrome is generally associated with chronic or long-term irritation to soft tissue. And that could mean muscle, connective tissue, ligaments, even deeper down in a joint. What happens over time is that the body, as a defense mechanism, it has a tendency to tighten the muscles up more. It has a tendency to make you more sensitive to things. So if someone were to come up and touch you or push on that area, you're going to feel more than you would normally, in an effect to protect you. So when this happens for a long enough period of time, it develops the general area. Let's say you injure your forearm, and the muscles around the forearm start to hurt, and then the pain starts to travel. That is all part of a myofascial pain syndrome development. And you find this all over the body. As a matter of fact, a lot of the pain that people feel that doesn't seem to go away can be attributed to this neuromuscular change, basically a change in the nerves and the muscles.
So you've been practicing Ahwatukee for 5 years.
So I've been practicing with Spooner for 5 years, Spooner Physical Therapy. I have been in the Ahwatukee location for about 2.5 years.
What location were you before then?
It was in Scottsdale.
Scottsdale.
Mm-hmm.
So what is the what are the most like if you go to McDonald's you get a hamburger, fry, and go. If you go to the dentist you get a cleaning exam, an X-ray, and a filling.
Uh-huh.
What is your cleaning exam, X-ray, filling? What are you mostly seeing? What's the typical? Why are Ahwatukee people seeing you? Because like when you say your forearm hurt, I'm thinking, okay, it's probably more likely they have a desk job. Is that a bias of mine that I think most people in Ahwatukee have a sedative, sitting down in a chair desk job?
You would actually be pretty. It would be safe to say that most people have a sit-down job. I mean, it's just the nature.
Most people do.
I would absolutely say that. I would say that most people have a job where they're required to sit, whether it be at home or in an office. Very rarely do you find someone who actually has a job that they're actually up and moving around. I'm very, very lucky in the fact that, not only do I practice, and so I'm up and about and moving around and moving my patients, which could be a very, very strenuous task, but I'm also faculty at Northern Arizona University. At the biomedical campus in downtown Phoenix, and I am always
downtown Phoenix. I saw that, but I thought NAU. Flags out. 3 of my boys went to NAU and Flag, and the good one went to ASU like that did.
Right, absolutely. My wife goes to ASU, so I
understand. You married well. You married well.
I did.
What injuries are you getting sitting at a desk, or is it not sitting at a desk, repetitive motion like carpal tunnel, or is it the weekend warrior stuff like you're doing cycling, or hiking? Is it weekend warrior, or is it repetitive motion?
That's a good question. Of course, you're going to see everything, but the most prevalent right now is when it is repetitive. The fact of the matter is that more and more people are experiencing lower back and neck pain, and that is what I see primarily in the clinic. And the reason is that sitting is actually a marathon of activity. When you think about it, you need to uphold your body in a certain position and perform certain actions in a very particular way if you want to function. And you do this on a repetitive basis 5 times a week or more for at least 8 hours a day. That is a lot of activity using the same muscles, the same forces going through the same structures all the time. And if you don't combine it with a variety of movement outside of that, you start to develop soft tissue irritation like we were talking about before, so the muscles along the back and the spine. But you also develop what we call compensatory patterns, basically things that you do in order to avoid using certain tissue because they hurt. So I would say that, for a physical therapist, depending on the practice, I would say across the board, very common things that you will see will be back pain. And more frequently, and this is what I see a lot of, are those individuals with neck and headaches. I find that individuals who spend a lot of time looking at computers or doing a lot of reading, they put their neck in a certain position that actually irritates, again, the structures around the neck, which can that can refer to the face. And that's actually where my interest in the jaw began. I used to treat a lot of individuals suffering from headaches and migraines in my early years of practice. After graduating from Regis University in Denver, I worked in a relatively rural location in Casper, Wyoming. And during that period of time, I saw everything you can imagine within the medical industry in my physical therapy office. But one thing that kept coming back to me were headaches and migraines, and no one knew how to treat them. So I started my education on the jaw, on the head, and on the neck there in Casper, Wyoming.
That's a beautiful area.
It is beautiful.
So we see everybody sees these commercials on television with these stand-up desks, and they say outrageous things like sitting is the new smoking. I doubt sitting in the chair you're going to get COPD and lung cancer and all that stuff. And then when you go to work, it seems like if you go into any business in Ahwatukee where there's at least 20 employees, someone's sitting on a ball.
Yes.
So if sitting is this marathon of activity, do you recommend stand-up desk or sitting on balls?
That's a good question. And typically what I tell my patients, also my friends and family, is that it's all about moderation. And I know you probably hear about that too, that everything should be taken with a grain of salt. What typically happens within the medical field is that this newfangled idea comes out in the research and everybody jumps on it, and they're generally this really extreme action where they adopt it and then they just take it to a level they really necessarily never should. Sitting, the bad thing about sitting is, again, there's the sedentary component, but again, it's the long-term use of the same muscles. However, if you can find a way to stand or move differently for about half the day, and you can sit for half the day, it's fine. The body is made to move, and the rest of the system, so your cardiovascular, your heart and your lungs and your digestive tract, also depend on that movement component. And so as long as you can keep to that moderation where you sit and you stand, you move differently throughout the day, you're fine. And I've actually seen people have injuries because they're standing too long. Just like anything else, I mean, if you do too much of something, the body is going to take that excessive stress and change the way you move and constantly cause dysfunction, which is what we want to avoid.
So when you said that when you left college, you went to Casper, Wyoming, and you were treating a lot of migraines and headaches.
Yes, I was.
How do you treat migraines and headaches? First of all, are all headaches migraines? Talk about difference in migraines and headaches, and how do you treat them?
Yeah, so there are hundreds of different classifications of headaches. Within my realm, within the things that I treat on a more regular basis, there are migrainous headaches, which are typically we think of migraines. There are tension type headaches. There are cervicogenic headaches, okay, and then there are also rebound headaches. Now, those are the four primary headaches that I would say that I will run into most often. Another one that's less frequent, but you may see, are cluster headaches. And we can go into each one of those if you would like. But the big difference is that your headaches, like migrainous headaches or tension headaches, are driven by the nerves and the blood vessels in your head. And they're generally associated with some sort of chemical component. Whether it be hormones or certain other factors, your response to the stimulus around you. So you've heard probably people saying, when I smell a certain perfume, I have a horrible, horrible headache after that period of time. Again, it's the body's reaction to external stimulus that causes change in the blood vessels and the nerves. So what research actually looks at is that when we're dealing with someone that has, or working with someone that has either tension headaches or migrainous headaches, there's a lot of evidence to show that having a healthy lifestyle, eating right, also having really good fitness, so making sure your heart and lungs are healthy, meaning that you do your cardiovascular training on a regular basis, can actually be preventative. Now, what can happen is that when someone has migraines or tension headaches, they never happen alone. And that's what makes headaches so difficult to identify and work with, is because there's so many different factors you need to take in consideration. But when someone has a migraine, typically what can happen is they start to guard, they get tense. They're in a lot of pain, so they generally assume sort of a guarded position, and other muscles and other joints start to get involved. That process of irritation can lead to what we call cervicogenic headaches. And cervicogenic headaches are those headaches that originate from cervico, meaning cervical, and genic, meaning originating from, so originating from the neck. When treating tension type headaches or migrainous headaches, I need to start looking at the stimulus that the person's having on a day-to-day basis to control for that. And also make sure that, too, they're giving themselves the proper tools in order to succeed in managing it, which means health and fitness. The four things that I look at when working with headaches or migraines are eating habits, sleeping habits, stress management, and activity. Now, within those, if I find that one of those are not normal, at least maybe a factor, a contributing factor to their symptoms, I refer. The fact of the matter is I'm a movement expert. That's what I do. I move people. I understand certain components of the body and how they go together to make that happen. But my practice is always really surrounded an interprofessional approach to managing pain. And so if I'm working with a part of the body that involves the brain, let's say, I automatically involve a neurologist. If I have something else that has to do with food or sleeping patterns, I'm going to probably talk to either a psychologist or a psychotherapist or a nutritionist, a dietitian. I can't do this alone. The fact of the matter is a lot of these people that come to me are in significant amount of pain and dysfunction, and if I want them to if I want to do them the best service, I need to incorporate other people. From that, that's when I started looking at the jaw. I saw this overwhelming presentation of people that would come in with these headaches and migraines, and they would say, oh, by the way, my jaw kills me. I didn't understand why, quite honestly, early in my career. And so what I would do is I would start I would just treat them the best I knew using some of these, basic principles. And they would get better, but it wasn't until that I actually addressed their jaw pain that I started seeing more significant changes in these headaches and migraines. And it wasn't everybody, but enough people responded to that I started thinking, hey, there's actually something to this. So treating a headache or a migraine, kind of the same thing, a migrainous headache, is very multifactorial, and it challenges me on a daily basis. But it's fascinating to see how changing even one of these different things in their life, let's say their eating habits or sleeping habits, can have such a large impact.
So what was the presentation you saw on TMD?
So what would typically happen is that person would come in and say, I have my migraines, I have my headaches, but I generally find that I'll have pain in my jaw before I have the headache. Or they would say, I have this pain in my head, and then it moves down to my jaw. Again, I didn't necessarily understand the relationship. And what I started to do is I would treat the neck because I knew that there was a neck component in migraines and headaches. And what I found was not only did the headache decrease, if we're talking about, let's say, those headaches that originate from the neck or tension type headaches, which can generally also include a symptom of neck tension. The neck tension doesn't cause the tension headache, but the jaw symptoms would also decrease. What I would also see with that was I would also see abnormal, aberrant movement happening in the jaw itself. So people would come in saying they have clicking or popping when they're chewing. Or these are the individuals also too with bruxism. Again, those people, for those people that aren't familiar with that term, is that clenching at night that happens. And so what I would typically do during those periods of time is I would be contacting that individual's dentist to say, hey, this person has headaches, they have jaw pain. What do I do? I don't know what to do with this. And the overwhelming response to that was, well, get them in, let's see what's going on, but we're really going to have to work with you in order to develop a plan of care because there are so many other factors when working with the jaw that need to be taken care of. And that's when I really started working on my interprofessional work as well.
Is there a dentist you work with a lot in Ahwatukee for TMJ?
There's not. Actually, I do a lot of referring out. I think a very common company in town, I think it's Southwest Pain Management.
Is that in Scottsdale?
It is. It's with, I think Dr. Cohen is the leading dentist in that group. And I see a lot of patients coming from that location.
Do you talk to him very often?
I talk to individuals from his office. So I'll talk to Dr. Cohen more in documentation.
Ryan, send me an email. We need to get him to come down here and talk about it. Because I got to ask you a question on that. Pretty much all my friends are dentists, right?
Right.
It's one of the biggest controversies in dentistry. Wondering how much of that is mechanical, how the teeth touch, or psychological. Right. And you said that eating, sleeping, stress, activity, and I think most of my dentist friends would say, well, when the teeth only touch maybe 1% of the time. In fact, when you're eating and you eat something, there's a rock in there or something, right? And your teeth actually do touch. Yeah. It actually scares you. I mean, these are massive force. Right. I mean, you could bite your own finger. So your teeth really don't touch that much. Right. But you're saying there's a lot of components to it: eating, sleeping.
Oh, there absolutely is. And
what percent of your practice is headache related?
Honestly, within the past 2 to 3 years, the majority of it has become working with individuals with jaw pain, as well as those individuals with neck pain, so after motor vehicle accidents, and migraine headaches and other types of headaches.
And I'm for my own personal observation, friends, family, and being a dentist and all, it took 30 years. To me, it's frightening how much over-the-counter pain medications these people take for their headaches. I mean, I know. I have friends at work that when they start to have a headache, I mean, they're taking 4 or 6 ibuprofen at a time, and you're like, God, read the label. What would you say to someone listening to you who says, who's really eating a lot? I mean, there are people taking a lot of ibuprofen and Tylenol. What would you say to that person listening right now who just lives on Advil for headaches?
What I would say first and foremost is that you need to talk to an internist about management of medication. As it is within our Practice Act, physical therapists cannot give pharmaceutical advice.
No, these are even over the counter.
Even over the counter, we cannot do that. But what we can do is talking about, again, that moderation component and speaking with a physician or a dentist if they're being managed through pain with their dentist. But this is what I do say is that typically when someone takes that level of medication, what happens is the body actually starts to acclimate to that level of medication. But what also happens too is actually you see what we call sensitization, basically meaning that certain structures in the body become more sensitive to stimulus. And the body's used to having the medication depressing or making things feel better. What follows, though, is that when the person does have pain and they're not taking the medication, it's much worse than it was before. That is actually what's called a rebound response. And I had mentioned before, one of the things that we do see in practice are rebound headaches. What happens with different types of medications, opiates are a big one. When you manage things for a long period of time, not only is there the possible addiction to the medication, but also, too, there's this sensitization response where the body feels more than it actually necessarily did before. And what I've done in those situations is I said, if I identify and I think that there is a rebound response, I speak to the internist or the physician or the neurologist who's managing those symptoms or the dentist and say, we need to figure out a plan and maybe you use your expertise and your specialty to determine what's going to be appropriate for this patient long term because this is not successful.
The opioid crisis, this is Tukeetown, so we don't talk about Ahwatukee. We don't care about those people in Maricopa and Chandler and Tempe and all those. But opioid addiction is a crisis in Ahwatukee too.
Yes, it is.
I mean, you can talk to any of your physicians, police, friends, family. I mean, I don't think there's a family in Ahwatukee that doesn't know someone in their family tree or work or whatever. Yeah, it is frightening. And I also am aware of a death from the Tylenol.
Yes.
Eating a lot of Tylenol, and a poor young girl went out drinking with her friends. And didn't know that you can't mix alcohol and Tylenol. Yeah. And then what's also sad is the extra strength. Just one pill's the maximum dose. Right. Do you know any American that takes one of anything?
No, I don't know.
I mean, have you ever eaten
more
one
is better. More is better.
I mean, if you're an American, if one works, two's better.
Right.
And this girl was eating a lot of Tylenol.
Right.
Then went out drinking, and her mom found her in a coma the next morning in her bed, and she was dead in 24 hours.
Right.
And that's just a huge, huge, huge tragedy. You also said something, vestibular dysfunctions, and I'm sure nobody in Ahwatukee knows what a vestibular dysfunction is.
Sometimes I don't think I do either. So what that is, okay, so there's kind of a theme with a lot of my interests. It has to do with the neck and the head. Again, the reason that I started being interested in the vestibular system is, again, because people would come in to me saying...
Well, what is the vestibular system?
Okay, good question. The vestibular system... So it's a way that we maintain our balance. It has to do with our inner ear. And there are 3 systems that give us our sense of balance. There's our sense of touch, our eyesight, and also our inner ear. The vestibular system is basically a series of canals in our ear. It's actually an organ where we have what we call autoconia, little rocks or crystals that sit in the ear. And depending on how we position our head, those crystals are going to move. And so what they do is they give us our relation of our head to gravity. Sometimes what can happen is that vestibular system, which includes nerves and other structures, can go haywire. What patients will experience is that they will experience, or not just patients, anyone will experience, is that they will wake up one morning, they'll turn on their side, and the world's going to just spin. They're going to get nauseous, they're going to start to vomit. That is associated with actually changes in those crystals or the rocks, the otoconia, in the ear itself, in the vestibular system. Now that, from my understanding, what I've been taught, that's an oversimplification of it, but still at the same time, it has a very real effect on someone's life. What will also accompany that is also sometimes, again, headaches and migraines. And so when someone would come into my office, they would complain of, not only do I have this headache and migraine, but I also have these really serious dizziness spells and these nausea spells. So I pursued additional certification and education in the vestibular system.
That is amazing. So I wonder what happens when they're in the space shuttle and there's no gravity for those.
Right.
Those rocks. What happens up there?
Well, that's a good question. The vestibular system functions relative to gravity, and I have never been in zero gravity myself, and I actually have not read anything in particular about the studies looking at the vestibular system in space. But I think that's really cool. That'd be really cool to look at.
I did read I forgot where I read it. It was a couple of years ago that one of the dirty little secrets of NASA is that they have a huge nausea and vomiting problem. Mm-hmm. And when they were doing the Apollo missions, I think, 13 men actually walked on the surface of the moon. One of the biggest problems is throwing up in their suit. Right. And so nausea and vomiting is a huge issue up there. Right. I want to go back to basics. A lot of people, they have a headache, they have pain, they have ever... when you drive around Ahwatukee, you see chiropractors,
yes, you
see physical therapists,
right.
You see. What's the difference between a chiropractor and a physical therapist?
That's a good question. Being my education, being in physical therapy, it's going to be hard for me to give you a lengthy discussion on what a chiropractor's job is. However, what I can say is that as a physical therapist, we, again, are movement specialists. And so when it comes to treatment and knowledge, we have a very deep knowledge of anatomy and biomechanics. And we use anatomy and biomechanics to identify movement disorders or movement dysfunctions that can lead to pain. And within that, we learn exercises that can correct for dysfunctions, as well as manual techniques. So using our hands to restore movement or to decrease symptoms in a certain area. One of my theories actually on physical therapists is that our job is to stimulate what we call acute inflammation, basically starting the healing process in tissue. And we do that through movement, whether it be with our hands or with the body. Now, with chiropractors, their specialty is in the skeletal system. And so what their skills are surround is their ability to facilitate a change in movement and what they would consider to be realignment of the skeletal structure, and consequently affect the greater system of the body. And again, that's probably a gross generalization of a chiropractor's skill set. But the difference being with physical therapists is that we also have a medical training background. So we have the ability to differentially diagnose and refer appropriately. Not to say, again, that chiropractors don't have that education, but the transition from a master's degree to a doctoral degree within physical therapy surrounds that idea that we also are direct access, meaning that when someone comes to us, we're going to do a full neurological screen to assess someone's functional deficits, as well as looking at some other systems. So again, the cardiopulmonary system, the very basics of the integumentary system, so the skin, as well as even the digestive system as well.
And does health insurance usually pay for part of this, or is it outside the health insurance system?
So yeah, health insurance will generally pay for it. There are a growing number of insurances out there that do provide direct access, meaning that if someone off the street is having back pain, and Arizona is a direct access state, that patient can go and see a physical therapist and say, hey, listen, I have back pain. What do I do about it? And we have the skill set to say, okay, well, let's take a look at you. Let's see what's going on. And if we don't feel they're appropriate for physical therapy, we're going to refer them to the appropriate provider. Or if they are appropriate, what we do is we develop a plan of care and we contact that patient's physician. We have to make sure that, again, with anything, that there is an interprofessional approach to care. But also, too, it's for the patient. The fact of the matter is that the more people we have on board, the safer the patient's going to be and the better outcomes you're going to have.
I got to tell you, people say one thing and they do another. And one of the funniest things I see amongst my dentist friends is that if you say the word holistic or alternative medicine, they just think crazy. They're just so against that, just knee-jerk reaction. But then when I watch, I'm a grandpa, I'm 55. When I watch all my 50, 60-year-old dentist friends, when their orthopedic surgeon, when they have lower back pain and their orthopedic surgeon says, we need to fuse your lower 5 spine, they're like, no. When their doctor says, well, your cholesterol's high, you need to start taking a statin, they're like, no, I'm gonna change my behavior.
Right.
And every time a dentist I see gets a disease, my God, they're alternative medicine holistic in 4 seconds.
Yes.
And then I say to them, well, Doc, you're sounding kind of holistic and alternative because the healthcare system, number one, you read these studies that 200,000 Americans die in the healthcare system each year, not related to their disease. I mean, it's only 30,000 car wrecks, 30,000 suicides, 30,000 accidents, and 50,000 opioid overdoses. All those combined are less than how many die in the healthcare system. If you just try to watch the news, it's either a commercial to take a pill, like restless leg syndrome, and then the next commercial is a law firm. Hey, did you take a prescription or a pill or whatever? Right. So the I see in the millennials. This is where this rant is going. I see in the let's go back to Jesuit. I see the older people. Look at the Ten Commandments. The first 3 are obey. There's only one God. Honor Him. The Sabbath. Yeah. The 4th one, obey your parents. The millennials are like, well, I'm not going to obey my dad if he's a bad guy and beating me up and beating up my mom. And so the older generation, if the doctor said you need to have your neck fused, well, you're the doctor, and then off they go. The millennials are like, you know what? I think I'm going to do a Google search.
I'm going to talk to Dr. Wiki or Dr. Google and see what Dr. Google says.
Yeah, and they're smart because they'll go to the Mayo Clinic website or Cleveland Clinic or whatever. But I think these millennials are going to push back on you go to a doctor. Well, how are you doing? Well, I don't sleep good. Okay, here's a sleeping pill. Yeah. I got pain. Okay, here's an opioid. Yeah. I feel depressed. Okay, here's a Prozac. You talk to them for 5 minutes and you get 5 prescriptions. Am I being too jaded?
Well, no, I think that that kind of mentality within medicine is something that has come more to the spotlight. And I think that, again, especially within the last few years with the opiate crisis, I think more and more we're starting to think about what are our practices. And again, not being a physician, I can only really speak to what the patients tell me, and also my own experiences with it. And there is this growing access to information. And the greatest difficulty I actually see now as a practitioner is making sure that the information that people are guarding themselves with is accurate. And that, I think, more than anything else, as a millennial, I'm going to read something, and my ability to differentiate between high quality and low quality evidence is actually very poor. There was actually a study looking at university students and their ability to differentiate between a reliable source online and an unreliable source. And it was very, very poor, which is very scary because it means that going back to this idea of having a physician tell you to do something in an older generation and doing it, the millennials are doing it too with the information on Wiki or on Wikipedia or Google, but just in a different way. So I think that as we talked about before, it really has to do with getting a second opinion, sitting down with someone else, and if that means that you have to start pursuing other avenues, which can include holistic approaches, the fact of the matter is, going back to those 4 things we talked about before, activity, eating, sleeping, and stress management, those are all things that are managed by more holistic methods. And again, that's a baseline. That's a baseline health. And I guess I would be considered more of a holistic practitioner, even though I'm also a medical practitioner. I'm kind of a blend between the two. And so I appreciate both when it comes to my practice. But yes, I would say that people are becoming more and more jaded with the practices that are being done in the management of pharmaceuticals, and also too the availability of their medical providers. The fact of the matter is that we have a growing population. We actually have a shrinking population of internists. We're starting to rely more on other medical experts, such as physician assistants and nurse practitioners, just because the load that these individuals have on a day-to-day basis, it's not sustainable. And so they've had to resort to these other practices just to make sure that, one, they do it in a safe manner, so they actually are in their own best they have the best intentions in trying to help the patient, but what happens is that the patient often gets lost in this cycle of pharmaceuticals, as well as in some cases gets lost between practitioners. People don't necessarily know what to do with the patient, so they push them off to the next person. That's what
it's so 5,000 different practice management softwares and all the healthcare providers all around the United. I mean, just in dentistry, there's probably 50. And so if grandma passes out at Safeway and an ambulance comes, all you got is her driver's license. You don't know, you don't have her whole health history. These patients come to you, and then with all the HIPAA violations, all that. I mean, back in the day, I could call up my pharmacist and say, "Is this person working me?" And she's like, "Howard, she's seen every dentist in Ahwatukee per month. She's got 50 prescription, you know." And it's just the fact that none of these software systems. I remember when Microsoft was getting accused of being a monopoly back when we were little, and I just sat there and thought, well, I don't want to. What good is me sending you a Word document if you can't open it? Wouldn't it be a really advantageous thing if everybody was on the same network? Healthcare seems to be the most bizarrely confusing system, and people don't talk about the fact that it kills 200. There's not even 200,000. Ahwatukee is only 85,000. Right. So it kills every single person in Ahwatukee every 6 months, and people don't. And it's sad because some of these older grandpas are confused because they'll all say, "What are you on?" And grandma will open up her purse and show me like 6 bottles. She can't even tell me what 3 of them do. Right. And you know the guy that prescribed this one doesn't know she's on this one, and it's just and that's why I think healthcare is so controversial in the United States, because there's the who's going to pay for it side of it, and then the other side of it is like, well, it costs so much because it's so crazily unorganized. I mean, a third of the bill is just pushing paperwork. That's right. And they never want to address efficiency and drive down costs. They just want to keep getting everyone in the system. And I look at my grandkids, and it's like, I don't know if I want my grandkids in the system. I mean, you go in there and they say, well, the teacher says she's hyper at school. Oh, well, here's Ritalin. You know, here's more. It's like, gosh, when we were little, we just would have recess. You know, we just go to PE. And
they're getting rid of that, though. I mean, they're getting rid of the things you think we do need on a day-to-day basis. We're getting rid of those things. It's counterintuitive. I want to go through you talk about eating, sleeping, stress, and activity. I remember having this huge debate in dental school. I said, okay, to my dean, I said, Dean Reed, everybody that ever graduated from this school said this is going to be the most stressful 4 years of your life. And then across the street was the med school, and up the street was the law school. And it's like, why don't we have PE? And he's like, are you out of your mind? Like we're going to have PE? It's like, well, we're all humans. I really think if this is going to be the worst 4 years of my life, maybe at 11 o'clock we should go play dodgeball for half an hour. I completely agree.
And they're taking it out of high schools too, aren't they?
And well, not just high schools, but more like even earlier than that. They're doing it in elementary and middle schools as well.
Yeah, and why do you need PE if you could take Ritalin?
Exactly, right. Or why do we need to do physical activity when you could be sitting in a chair for that much longer during the day learning material that the students aren't actually learning? You know, the interesting thing when you look at the learning literature and is that as people, we have about a 15 to 20 minute attention span.
Right.
After that 15 to 20 minutes, you know what? It's really up in the air as far as what you're going to learn. And so what needs to happen every 15 to 20 minutes is we need to have a change in activity. It's not just sitting down listening to someone talk to you. It's getting up and moving, interacting with things, going outside and doing something completely different. We are going to better prepare our children to be successful if we do something like that. And again, you had mentioned I have a 4-year-old little girl. I also have a 3-month-old boy. And I'm starting to think about these things more than I've ever done in my entire life. And I had mentioned earlier, prior to sitting down and speaking with you, that I'm actually starting to now feel like an adult, because I'm starting to think about these things that normally as a millennial we don't really care about. But I'm starting to care about it because it does greatly impact not only myself but also to the future of my children. And so having these things, going back to these 4 things, not just within practice but also in my life, which I've started to do much more, has greatly helped me manage my life. And I feel healthier for it. Again, being at Northern Arizona University in the biomedical campus and teaching physical therapy students, they're in the same situation that you were in dental school, or I was in PT school, is that they are absolutely stressed to the max. They're not given enough time to manage most things in life because there are requirements set forth by national standards that they have to meet, and we're doing it in a certain time frame. It's just the nature of the beast. And so with my students, I will have this conversation in the very beginning saying you have to be accountable for your health. When you start this program, it is going to be stressful, but I'm going to tell you right now, you make time for yourself. And even if you feel like you're not studying enough, the fact of the matter is, and again, the literature shows that you are going to do yourself a better service going out and exercising for an hour, eating right, instead of studying for that hour and a half for a test that you're not going to remember 90% of the material that you studied for. Do something for your body. You're going to be able to think clearer and concentrate better. You keep going back to eating, sleeping, stress reduction, activity.
Let's open up a huge can of words, eating.
Okay.
At 55 years old, I think I've lived through 487 diet fads, and it just never stops. I mean, it's the South Beach, it's the paleo, it's the caveman. Now the rage. Everybody's talking about putting your body in ketosis.
Yes.
All probably a third of Americans are overweight. When you say that, a third overweight. What are your thoughts on eating, and is there a fad you're in love with? Or what's the diet of the day?
The diet that actually I have run into quite a bit. And when I talk to my patients, I actually like to experiment with them myself, because I'm kind of curious to say, what exactly is it and what does it do? So some of the things I've heard more frequently are paleo is still a thing, very much so, but also something new that's called the Whole30 diet. I've run into that a lot.
Whole30?
Whole30. Mm-hmm.
Never heard. Whole WHO?
WHOLE. And it has to do with eating whole foods. So those non-processed foods. Also, there's limitations in the dairy, sugars, grains, legumes. So what you're basically eating are, or even some fruits. So those fruits with higher glycemic indexes. So like your ripe bananas, your mangoes, those are kind of pushed to the back. Avoid those. So you can eat your berries, but your meats and your vegetables are going to be your primary foods.
What's the primary foods?
Your vegetables, your berries, your nuts. Again, avoiding peanuts because that's a legume, but also your meats as well.
That's very confusing. I've always thought they should not be able to allow to call that a peanut, because I've seen it with my own grandchildren where they say, "Well, nuts are good for you,"
right?
And they're eating peanuts,
right?
I'm like, that's not a nut.
And
they'll even point to the peanut. It shouldn't be called a peanut.
It should not be called a peanut
because when they read about nuts, what are your favorite nuts?
I really like almonds. I love almonds. I also love pistachios as well.
So does that mean you climb pistachio? Oh, Picacho Peak. I always get that mixed. I read an article the other day that 80% of the people on a gluten-free diet don't even have a gluten allergy.
No, that's correct. Yeah.
Why? So you're okay. Let's talk about dairy.
Yes.
I notice that people believe things more if it's a story. Like they'll say, "Well, this is natural because this is what the cavemen eat." I mean, 100 billion humans they have come and died. Mm-hmm. There's 7.5 billion alive now, so 7.5% of every human that's ever lived is alive today. Mm-hmm. and they say, well, this is what they've been eating naturally for 2 million years.
Right.
I'm like, well, do you know how long they lived? The disease, but what? And when it comes to dairy, they say, well, milk. I mean, when you nurse a baby, and you go to some countries like Ethiopia, I mean, they'll nurse 2 or 3 years.
Yeah.
If milk is the only thing that a human can live off with nothing else, then dairy has to be good. What's your thoughts on dairy?
Yeah, so that's a good question. And typically when someone has like deeper questions about nutrition, I'm like, please go see a dietitian. But my thought on dairy is that, that the reason that a lot of us do have difficulty with dairy later in life is because we actually start to have less lactase. For whatever reason, our bodies start producing less lactase, so our ability to break down lactose, which is the sugar in the milk, decreases. So we start having a lot of irritable bowel type symptoms. But the other thing is that there was a huge fad again with non-fat foods, and that was a fad, and now it's switched all the way over to now you want to eat all your fats and your whole fats. But with milk in particular, this big push for non-fat milks, and they actually found that it doesn't necessarily, having a non-fat diet doesn't prevent cardiovascular disease. As a matter of fact, it may make it worse. And so now they're saying, okay, well now you have to have your whole milks and your whole cheeses, and so people are just having tons and tons of their whole fats. So avocado oil, they're having eating lots of other nuts. They're having their whole milk. They're having their whole cheeses. And again, I always go back to moderation. I think that if you're going to have milk in your diet, don't have a glass of milk with every meal. Maybe I'll have a glass of milk a day. If you're going to have cheese, again, have cheese maybe for one meal of the day, but incorporate a variety of things within your diet. Again, doing the Whole30, I've seen some amazing results. I've done it myself like 5 or 6 times, and I do it basically to keep myself on track, to limit how much grains I'm eating or processed foods, because that's the biggest thing. It's trying to get away from those processed foods. One other thing too that you're also going to see too is something called intermittent fasting. And that is another type of trend that people are starting to utilize. And what that is basically someone eats the night before and they don't eat until about 1 o'clock the next day, 1 p.m. the next day. And that is also, again, the research is looking at that to see the benefits associated. Apparently, you're reducing your caloric intake. Your body's having to use those fat reserves in your body in order to power yourself throughout the morning. But also, too, it's been shown, at least in the short term, to decrease, your blood pressure and your heart rate and just make you feel overall better. Again, going back to what I tell my patients, it's all about moderation. And if you want specific guidelines as far as what you should or should not be eating, I'm going to refer them.
But what percent of Americans are moderates?
No one is. I mean, I don't even think I am, to be quite honest with you. But that's the important thing of it, right? And if someone can look at their life and say, okay, well, today I'm going to try to be moderate with one thing. Hey, at least you're doing something. Even if it's that one thing that's saying, you know what, instead of sitting down in my chair for 8 hours a day, I'm going to get a ball, and I'm going to sit in my chair for 4 hours that day, and then I'm going to bounce in my ball the other 4 hours. Fantastic, And then, we'll worry about the other things down the road. But the biggest thing is tackling things one thing at a time. Information is overwhelming. And I think that depending on how we present this information, I can overwhelm my patient very easily talking about, well, you got to take into consideration your dairy and your sugars and your grains, and you need to worry about your activity, and you're not moving right, and it's this muscle, it's that joint, and you're taking these pharmaceuticals, and you have to worry about your insurance. And so when it comes to someone's health, it's never simple. But if you can simplify it for the patient and putting it in manageable bites, you're going to be a lot more successful. And that, I guess that was a non-intended pun when talking about diet and food. So what are my Ahwatukee homies going to find on your website, spoonerpt.com? Yes.
How do they contact you, and what's on your site?
So,
when you were talking about that Whole 30 diet,
yeah.
is there a link to that on your site?
There's not. And again, what you will find though is that on the site is that you're going to have a list of different locations for the company. You're also going to have access to the individual numbers and addresses for each location. The fact of the matter is that Spooner Physical Therapy is growing very, very rapidly. And I don't have an accurate count at how many clinics, to be quite honest with you, but I know it's more than 16.
Which is good because maybe if you live in Ahwatukee, but if you work somewhere else
That's
in
right.
the valley.
Right, exactly. So again, a lot of people in Ahwatukee commute, and they'll commute into maybe downtown Phoenix. The fact is we have clinics there as well. But each clinic is going to have a series of specialists available to them. And those individuals that will be able to talk about these different things as far as pain management, as well as other things that can help manage their day-to-day life. And so, if you go to the website, you go to a location, you're actually going to have a list of physical therapists. As a matter of fact, I think that's how you found my bio. And under each physical therapist, you'll be able to read about that physical therapist. I'm not familiar. I don't think that the physical therapist email is on there, but definitely the company's HR email is on there, as well as individual contact numbers for each clinic.
Well, how do they contact you? What if someone listening wants to contact you?
Right.
What would be the best way there?
So,
first of all, tell them where your office is. You're at 40th Street.
40th Street in Pecos, and so
you have that big covered parking.
The covered parking. So now I know. So the covered parking across the street, you kind of have that big open area. They have a lot of construction now that's going on. If you go just north to that. There's a medical complex there. That's where we're located. So we're actually
Are you talking up towards Fry?
South of Fry's.
South of Fry's.
Fry. So you have Fry's, and then you have that residential area.
Yeah.
And then just south of that, you have a medical complex.
Yeah.
It's going to be
on the east side.
East side,
of the street.
right? East side.
So, are you hearing a little noise these days? A lot of construction going on down there.
There is a lot of construction, and traffic has also been very different. That light, when you go south on 40th, you actually have to travel north on the 10 to get home. Has been a nightmare for me. And so I'm trying to find other ways to avoid that light at all costs. And so what I've actually been doing is going up to Chandler.
So there was also a couple articles in the newspaper in the Ahwatukee Foothills that there's a strange smell down there.
I have not smelled anything.
I haven't smelled it either.
Yeah, I don't know.
But they say it's closer to 48th Street. And Pecos.
Okay. Yeah, I have no idea what's going on.
Because a lot of people... they've sent out the gas people. You know, they first thought, well, it's a gas leak, and SRP's like, there's no gas leak. Yeah, but so how long will that project be under construction?
From what I heard, at least, it's all hearsay as far as what I've been told by patients, but it's going to be for a couple years.
A couple years?
Yeah, a couple years.
And do you know that when the 202 is done, what I've been hearing that there's going to be 3 interesting exits on it. Is 40th one of the exits?
I don't know.
You don't know?
I don't know. But with the way that the construction's going, I sure hope they're doing something there because it's taking quite a long time and they're doing quite a lot of work.
You talked about eating. Mm-hmm. You talked about sleeping. Let's talk about stress and activity.
Yes.
It seems to me, it's tough because you want to go exercise, mm-hmm. but most of my friends, whenever they broke something, they were
yes.
they were trying to do the right thing. They went out. Like I have a really good friend, bought himself a bicycle. Mm-hmm. The first thing he did on the first week, he's going to become a cyclist. First thing he did on the first week is fell off his bike and broke his clavicle. Yeah. Weekend warrior stuff. What is a safe activity? And you're cycling, which
right?
Are you on the street or are you on?
Oh yeah, I do it on the street, and I have learned very quickly how dangerous that can be within Ahwatukee and also Phoenix. And so I make sure that I protect myself as much as I possibly can. But as far as a safe activity. When looking at activity, there are certain guidelines that are put forth by a lot of different organizations out there. The American College of Sports Medicine is one of them. And what they really look at is that when you're looking at physical activity is cumulative. Meaning that if ideally you're going to be doing about, 20 to 30, 40 minutes of exercise every day, okay? You can do 10 minutes in the morning, 10 minutes at lunch, 10 minutes at dinner, and you're going to get the benefit as if you worked out for 30 minutes.
You believe that?
Absolutely.
Really?
I believe that. And
so that's what you're saying, it's cumulative.
It's cumulative.
So 3 10-minute workouts, breakfast, lunch, dinner, is the same as a half-hour
Yes,
workout.
it is, as long as you make sure that you're incorporating that cardiovascular strain. So what I mean by that is getting your heart rate up and getting a sweat going. If you don't get that, you're not getting the cardiovascular benefit. And I guess we should really differentiate between different types of exercise because there's strengthening and there's also that cardiovascular component. And you can exercise your muscles and get very big muscles, but you aren't necessarily working your heart, depending on how you're using that exercise. When you talk about weekend warriors, the fact of the matter is maybe they're very, very sedentary for 5 days out of the week, which is very unhealthy. And unfortunately, working out 2 times at the end of the week isn't going to reverse all of the negative effects of sitting down every day. What I talk about activity is different than exercise. Activity has to do with getting out and walking. Being active is very important. So if you're in your office, sitting down for maybe an hour or two, getting on your ball and bouncing up and down, maybe taking a walk around the office for 5 minutes, coming back, sitting down for an hour, making sure you're changing your routine. That has to do with activity. It also really greatly affects our mental health and emotional health. For those weekend warriors, what I would highly suggest is that you watch the intensity as well. Ideally, what I'd like you to do is, of course, have some sort of exercise components during the week. But if you're going to do something during the weekend, make sure that you're not doing heavy cardiovascular work unless your body's prepared for it. If you're trained, that's one thing. But don't go in and hit the gym for 3 hours at one time, because you are going to injure yourself. The fact of the matter is, the entire week you're not preparing your body for that movement, and all of a sudden you're throwing this intense movement at it. It's not going to succeed. And so you're going to have your tears. You're going to have your breaks. And you may even have more serious health complications if you don't prepare yourself for what you're going to do. And at least keep some sort of semblance of that activity throughout the week.
If you want to have a bunch of gold medals in the next Olympics,
yeah.
You have to start that process 18 years ago when these little kids were 5. How you're farming these kids at 5 will determine what will happen 15 years later in the Olympics. I find it very interesting in Ahwatukee. Sports has really been flipped upside down, because there's families in Ahwatukee where dad played in the NFL.
Yeah.
They won't let their kids play football,
right?
Because they had soccer. It's so funny. Like in boxing, they pad their hands.
Yes.
But not the head.
Right.
I mean, the hands weren't. Right. Soccer, I can't use my hands, but it's just bouncing on the frontal cortex. Yeah. Do you see downward pressures on football and soccer, since I can give you names?
Yes.
Like you had a 4-year-old girl. Would
yes.
you let her go into boxing, yeah. football, yeah. or soccer?
Right. Not without the proper protective equipment. I did martial arts when I was young. And so I've been hit in the head a lot. But I was always in a protected environment. People were very aware of what I was doing. I was wearing protective gear. I was wearing a helmet, and we also had padded gloves when we would spar. The problem is, of course, any time you're active, any time you're putting that much force through your body, there's risk. A lot of people are starting to reverse a lot of activity because a lot of the information is coming out with TBIs and concussions. And the fact is,
what's a TBI?
Thank you. TBI is a traumatic brain injury or traumatic brain incident, and that's very real. And so, I have seen a downward trend. I have seen a switch as far as what people are doing, but it also follows this trend too of decreased activity. And for me personally, for my little girl, I'm going to say, yes, there is risk associated with an activity, but by not having them active, by not having them engaged on a different level, they're losing a quality of life that they're not going to necessarily completely understand. And so for me personally, my choice for my child is going to be, we are going to try these things. You're going to do them. And I'm going to educate her like ahead of time. You're going to get injured, but I'm going to help you to make sure that you're going to limit that risk as much as possible. But again, I believe that for our children, we do them a disservice by limiting the physical activity. Now, it's not to say everyone has to do football or everyone has to do soccer, but having them do something different that is still physically active is still going to give them that benefit, not only physically, but also socially as well.
I don't know. I got a little feeling that Liliana is going to be a spoiled little princess.
Yes, she probably is. Yeah, and honestly, Rowan, who's my little boy, will probably also be very, very spoiled. Yeah. But they're worth it.
Hey, I cannot. We haven't even launched the Tukeetown website yet. Mm-hmm. It's going to be about 2 weeks.
Yes.
And I can't believe the views on this at iTunes. And I've already, lots of people already contacted me. They have an hour commute. Uh-huh. You're talking about that traffic.
Right.
And we haven't even told anybody about this and the YouTube channel, because if you go to YouTube and type in Ahwatukee, or if you go to iTunes, type in Ahwatukee, it's the only podcast. But all the feedback says it's so great. I got an hour commute. They say I can't listen to radio because it's half commercials.
Is that the case?
And then the other half, it's so toxic. It's always Putin and Trump and Hillary and emails and North Korea.
Right.
And they told me they just love this podcast.
Yeah.
And I just want to thank you so much for coming over.
Well, thank you for having me. I really appreciate it. Absolutely,
on their hour commute to work. It was fun. It was informative. And
absolutely.
Thank you so much.
It was a pleasure. Yeah, absolutely.
Oh,
thank you very much.